Well, Uncle Mark,
Here I am.
here's the thing.
Yeah.
Some people make choices in their lives that get them into a situation, and then they need to make other choices.
Yeah.
I don't even know what I'm talking about.
I feel like this is you telling me we're breaking up.
Well, I think we need to abort the show.
We're going a different direction. So, well, we've done many how-tos on the show, Dan, and I think some of them have been helpful. Some of them have been.
Most of them are just dreck.
Most
of them are just us blathering,
just cutting room floor garbage. But we do honestly want to have conversations with people who are smarter than us to talk about. Things weighty and things not. And today I think we're talking about something that a lot of people would consider weighty.
Yes.
And we have invited our friend Dr. D here, who is, among many other wonderful things, an OBGYN, a sex educator, and an abortion provider in a red state here in these United States.
And honest to God, Dr. D, thanks for coming back on the show.
Thank you guys so much for having me back. I'm very excited. I've missed you all dearly.
I know, it's been so long.
It's been an age. So we have invited again a person much smarter than we are here to talk about something that I think we all could continue to talk about in saner ways, and that is how to talk about, to think about, to understand,
to have an
abortion.
Yeah.
If that's something that you have maybe struggled with as an idea or a moral conundrum in your lifetime, and I think many of us have. So let us have a frank discussion about what it is and what it is not.
We're going to teach the controversy,
and when appropriate, Dan and I will mansplain to Dr. D.
Yes,
so,
indeed.
Yes.
We will do our damnedest to make sure that our opinions matter the most.
Yes, because what the abortion debate needs is more men yelling about it.
More menfolk in it. It's white men at that.
Yeah.
We couldn't do it without you, so.
So, Dr. D, where do we start? What is abortion? What are we talking about here?
Great question. So, abortion, in strict medical terms, means the ending of a pregnancy. And so abortions can be spontaneous or they can be induced. So spontaneous abortions are miscarriages, or more commonly known as that. And induced abortions are when you cause a pregnancy to end by a variety of means. There's self-induced, and then there's medically induced. So self-induced would be taking medications to try and cause the pregnancy to end, throwing yourself downstairs, a sort of dramatic example, but something that happens.
Not recommended.
Not recommended. Yes, absolutely not. And really tragic when it does occur, because it really is an instance of last resort for many women. And then there's medical abortions, where an abortion is done under the guidance and supervision of a physician. And that can be done using pills that you take that cause the pregnancy to pass at home, sort of like having a heavy period, or it can be done through a simple office-based procedure.
Yeah. So, okay. This is a topic of some controversy in these United States of America and abroad. In part, mostly, is it mostly just because religious people hate it? Is that where we're coming down on this?
It is primarily, the resistance against abortion primarily does come from a religious community, but one can be religious and in favor of the right to choose. Those are not mutually exclusive.
Right.
And there are actually a lot of religious organizations that openly support women's rights, women's reproductive rights, including the right to have an abortion.
I just wanted to throw out there that in my little bit of research for this thing, I noticed that I found out that fully a third of Republicans are pro-choice, are in favor of the right for it to be legal in all or most cases.
Right. Yeah.
And then independents and Democrats, it shoots up. It's like 60 and 75% respectively.
Right. Yeah. So I think, your opinion on abortion is not primarily determined by your political affiliation or your religious affiliation. The opposition to abortion, it's hard to pin down the exact reason, but a lot of it comes down to controlling reproduction.
Right. And why would we want to do that?
Right, exactly. I mean, so the ability to control your own reproduction is, a passport to opportunity, to growth, to a world that wouldn't be available to you if you were, forced to continuously become pregnant, to not have access to birth control, to not have access to abortion. It's a ticket to health.
Yeah.
Pregnancy is a stressful time for a woman, emotionally, physically, financially, and so the ability to control that aspect of your life opens up this whole new world.
Well, I mean, not only
some people
pregnancy,
have an interest in controlling that.
Not only pregnancy, but like motherhood costs a fortune.
Yeah. Yes.
Just so being able to choose whether you have a child or not seems to me to be a great boon for any woman.
Yeah, we did a piece. I don't know if you had a chance to listen to it, Dr. D, a little while ago. That we talked about child brides as a phenomenon in the religious world, and that was a big part of it. Was basically having people who are not done being children make more children robs them of any opportunity in life, right? They just.
Yep.
And so finding a way to, prevent child brides, which is not the subject of this discussion, but basically a way to liberate people from a cycle where they're just making more people until they are in a position to choose to do that freely is a good thing.
Yes. I think, you've completely hit the nail on the head. I mean, I think it's about, and it's not just about that individual person, it's about our society as a whole. Children are taken care of, the children who do exist. The parents have the capacity to love and provide attention and to provide for their children. They have the ability also to provide for themselves and to be complete people and to contribute in their own ways to society, to achieve an education, to get a good job. I mean, all of those things are tied into each other. So it's not just about that individual person who is pregnant, but really it's about our success as a society, and it's, the people who have abortions have them for a variety of reasons. The most common reasons tend to be financially. They feel like they cannot support a child or another child. 2/3 of women who have abortions are already parents. So
2/3.
2/3.
Yeah.
Yeah. Mm-hmm. It's not, it's not the teenager who was irresponsible and didn't think to use birth control, or the college student who was, out hooking up. It's all these like preconceived notions that we have about who has abortions.
Right.
And the reality is everybody has an abortion. 1 out of 4 women, and it runs the gamut. But most of them are mothers, and they know what it means to be a parent and to bring a child into this world. And
it is a very informed decision that the bulk of these people are making because they've confronted it before.
Right. Absolutely.
I find it interesting. Now, one of the things that we sort of talked about in leading up to this was the notion that abortion is healthcare. This isn't. We're not talking about like just sort of a whim or whatever. This is something that a lot of women that it's about their health and it's about their well-being as people.
Yes, absolutely. I mean, I think some people don't want to believe that abortion is healthcare, but an abortion is on the spectrum of the reproductive health cycle that people go through. And so you cannot minimize the impact that a pregnancy has on somebody. And so the decision to become pregnant is a big decision. And if it happens and you are not financially, physically, or emotionally ready to take that on, then the best thing that you can do for your own personal health is to choose to not be pregnant. And by making that choice, you are furthering your own capacity to be a complete person who can have a complete life. And what is healthcare but not giving the people the capacity to function at their highest and best self, And so you can't separate abortion from healthcare. a woman, is born, goes through puberty, menstruates, becomes sexually active because we are human and we have sex, and that's important. And we choose to contracept or not. You become pregnant or not. If you become pregnant and you are ready to be pregnant, then you have a child and you continue on. If you become pregnant and you are not ready to have a child, then you have an abortion and you continue on. And maybe then you finish college and, in 2 years you get pregnant, or maybe you have an abortion and you wait another 2 years till you're ready to have your third child because you got that job promotion that you were waiting for that now allows you, it's a part of our cycle, and it's right. You can't separate it out.
Now, one of the arguments that we hear from the anti-abortion side of things is that abortion is dangerous for women, that it's medically unhealthy for them. Can you talk about that a little bit?
Yeah. It's an interesting thing that the anti-abortion camp they sort of talk out two sides of their mouth. They try and say that abortion's not healthcare, but then they try and over-regulate it and say that it's dangerous and it should only be done in hospital settings. And I think, the reality is that abortion is incredibly safe. A first trimester abortion is many times safer than a full-term pregnancy.
I'll bet. Yeah, I would imagine that's true.
And, and a second trimester abortion, even at the latest gestations, is no more dangerous than a full-term pregnancy. And I think it's a common misconception that, abortions are unsafe, that they impact your future fertility. And it's just not true. Abortion is one of the safest procedures and the most common procedure that a woman can have in her lifetime.
It is in most cases, an outpatient clinic visit procedure, correct?
Correct, yes.
So you go in, you come out the same day. It is not major surgery in most cases.
No, procedure takes anywhere from 3 to about 15 minutes.
And circling back to what Dan was saying, there is these incredibly common bits of misinformation that are so in the bloodstream out there that it will cause breast cancer, that it will cause sterility, and difficulties with pregnancies later in life. And those have all been pretty much shown to be bunk.
Correct. I spend all day answering questions from people, if I have this procedure, am I going to be able to get pregnant again when I'm ready to? And, the truth of the matter is that safe legal abortion does not impact your future fertility. Wow. It's an incredibly safe procedure. You can have 1, you can have 5. Uncomplicated abortions do not impact your future fertility. Unsafe abortions can, because they carry a risk of complications and infection. So right. When you make abortion illegal and you drive people underground, then you lead people to unsafe abortions that can impact their fertility. So when abortion is accessible and it is safe, then there's not an issue. The breast cancer has been completely debunked. There's right. no link. We know that giving birth does protect you against breast cancer, but having an abortion in and of itself has no impact on that.
So your risk for breast cancer is the same after your abortion as it was before you got pregnant?
That is correct.
That's interesting. Okay.
And there's something that I also want to talk about is the incredible commonality of this situation. When you sent me a link to, I believe, a group called Shout Your Abortion, which I really thought was fascinating. And it does definitely, it's basically women saying, I'm not ashamed of this. I'm not angry about this. I'm not hurt by this. But also 1 in 4 women before the age of 40, if I read that stat correct, mm-hmm. Will have had an abortion. So everybody knows somebody who's had an abortion.
Absolutely. Yes.
I just want to, that's an interesting point, because the narrative that we got, and I grew up in the 80s, and you watch the after school special, and it's meant to be the most tear-jerking, gut-wrenching decision a young woman can make in her life. Oh my God, I am going to have an abortion, and what will the Lord think, and what will society think? And also there's this narrative out there that all women instantly connect to the to the zygote inside of them, and like it will take a part of their soul away if they have this abortion. And I don't think that narrative is true.
Women's experience with abortion are as varied as women themselves. And so you can't...
So they're all the same then.
Exactly. As some people would want you to believe. It is a very personal decision, and it is always a personal decision. But it doesn't mean that it's a wrenching decision or it's a sad decision. Some women are incredibly empowered by their abortions. It is an opportunity for them to sort of take control of their lives and to decide when and how they will have children. And for some women, it's an easy decision. I got pregnant, I'm not ready to. And so this is what I choose to do. And this is the best thing for me. And I don't need anybody to tell me differently. For other women, it can be more challenging. What I hear a lot is, I wish I was in a place where I could carry this pregnancy.
Right.
I wish that I had the support of a partner. I wish that I had the financial resources. I wish that I had the time. I wish that I didn't have this child who has so many needs that I can't have another child because I need to focus on the one that I have now. That's what I hear.
Right.
So it can be difficult. But it doesn't mean that it's the wrong decision just because it was a hard decision.
Right.
It doesn't mean you're bad if it wasn't a hard decision.
I'm sure, there are those women who are empowered and are like, this is not the time for me. If I do it, this is going to happen, it's going to happen later, but I'm not doing this now. But I'm sure you see like the happy couple that discovers they have a non-viable they wanted to carry the baby to term, but for whatever reason, they shouldn't. And I'm sure that's, very sad and very heartbreaking for them, but it's still, if it's a non-viable fetus, it's still the right decision, yeah?
Right. I mean, I think it's an important subset of abortion that is important to talk about. It is a small number of the abortions that are performed, but it's a very important aspect. And I think when we talk about abortion, people don't think that it applies to those situations and that the regulations that are passed by states don't apply to that situation. But they do. I mean, these types of abortions for fetal anomalies are regulated just in the same way that any other abortion is regulated. So
That's
when
crazy.
we talk about these things, these laws that are passed, it affects any woman who's pregnant and can't or doesn't want to be. And I think, the fetal anomalies are particularly heart-wrenching. But I will say that, we sometimes talk about elective abortions and indicated abortions. And I think, we really need to move away from that language, that an indicated abortion is if it's, for the maternal health or if there's a fetal anomaly, and then everything else is kind of those elective abortions. But there's not really a such thing as an elective abortion. Every abortion has an indication, the indication being that person who is pregnant does not want to be pregnant anymore. And that's your indication. And their reason is valid, whatever that reason is.
And why the hell, as a society, would we want any child being born into an environment where it can't be cared for or the person doesn't want to care for it? Why would we want that as a society? That's madness.
Yeah. I mean, it's something that we really need to examine. I think when we talk about, the anti-abortion movement, what is the end goal here? Because really, they are not pro-life. They're certainly pro-birth. But
Absolutely.
if these people were passing laws that mandated paid parental leave and affordable daycare, my patient numbers would probably drop in half. If people had access to contraception at, readily available, a method of their choice at a reasonable cost, my numbers would drop in half. But we pass these policies that make it so much harder to parent. And then we vilify women for having abortions.
Yeah, this was something that drives me completely berserk, which is, occasionally I will have to tip my hat to, say, the Catholic Church, which I know I'm on very thin ice saying this, but they're like anti-abortion, but they're also anti-war and they're anti-capital punishment. And I'm like, okay, there's some, I can see a thread of consistency through this idea that life, in whatever form you describe it, is sacred. But with the screamers on the other side of the debate in this country, who are screaming misinformation, who are screaming at women who have made a choice, whether it was hard or not, to walk into a clinic, and are protected by the First Amendment for this screaming at these women who might be in crisis,
right? Which
is just insane to me. It's like screaming at people going to get chemotherapy. What the fuck is wrong with you? They are pro-birth. This is they fight sex education in schools. They fight contraception. They won't let their girls get the HPV vaccination.
It's insane.
And then the second that fetus draws breath, it's on its own.
It's on its own. Fuck you.
Right.
We don't care about you anymore.
They're cutting WIC. They're cutting pre-K. They're cutting any possibility that would help this woman and child together have a fighting chance.
Look, Uncle Mark, if an infant can't pull itself up by its own bootstraps, then what are we even doing here?
If it didn't inherit $1 million, then fuck it, right? So,
right?
But yeah, that's if there was a consistency in the other side, I would at least have to tip my hat a little bit.
Right.
But there just simply is not. And so you can as a sex educator, I'm sure you have plenty to say about the state of sex education in this country and the access to contraception.
Yeah, I mean, it's abysmal. And I think, we have such a wrong approach to sexuality. We're still such Puritans at heart where, we don't want to talk about sex. We don't want to talk about birth control. We don't want to talk about abortion. And we vilify people. I think ultimately sex, pregnancy and abortion is proof that somebody has had sex, right? And it's an opportunity to vilify these people. And the shame comes down on the woman because she is the visible bearer of that shame of sex. And I think we just, hopefully one day we'll be able to move past that and talk about sex in a healthier manner. I mean, we know that if you can have engaged conversations with young people about sex and safe sex, that they're more likely to delay first intercourse. They're more likely to use contraception at their first episode of intercourse. Those are all things that we should strive for, but yet we just choose to shame people. And a lot of the struggle that I see in people with abortion relates to that external stigma and shame that they carry and they perceive from other people.
Yeah, it baffles me. Here's the thing that doesn't baffle me. I understand that a lot of people believe, and I actually sympathize with this. A lot of people believe that a human being is being killed in this process. And to me, that I'd like, if I believed that, man, I would be horrified by the concept of abortion, I think. But I mean, is that what's happening?
It's, I think we're sort of entering into sort of a philosophical argument at this point. And, what is life and, and what is a person? And so, an embryo has the capacity to become a person if that pregnancy is continued and results in a birth. So, is that a life? It's a life or it's a potential life. I mean, I consider it to be a life, but I think the question that it comes down to is whose life do you value more? Do you value the life of the person who is pregnant, or do you value the life of the fetus?
Right.
And I will say that if you think you're valuing the life of the fetus over the mother or as parallels with them, ultimately, if you're forcing this person to carry a pregnancy and to have a child that they do not feel they have the capacity to do, how is that valuing the life of the fetus ultimately?
Right, and you're valuing, it's a fetishization, I think. That's
clever.
It is. It's a fetishization that comes from religious, even if people aren't doing it, if it isn't directly religious, it is so part of the American culture that there is this, that women are this slightly different class of people who must be servile at the same time that they're put on a pedestal, meaning therefore that they really shouldn't be in charge of these decisions. But you're asking you're valuing a pre-human, something that has the potential to be human, over the person that is going to be on the hook for at least 18 years.
And is already a human.
Undeniably,
already a human.
Yes. And this is the thing, when we talk about pregnancy, and the fetishization is really, I'm glad that you brought that up, because we think of pregnancy as this, rosy-cheeked, round belly, radiant woman.
Oh, it looks like pure hell to me. I don't know how. Oh my God.
And then the rosy-cheeked little baby cooing in the pictures and the cute little outfits. And, nobody shows you that, the swollen feet, the vomiting, the hypertension, the diabetes, the prolonged labor that ends up in a C-section, and the sleepless nights of the colicky baby who, won't sleep. And people forget about that. I mean, so I remember, I'll tell you a story. When I was a second-year resident in obstetrics and gynecology, I had dinner with my old college roommate who had just found out she was pregnant. And we were talking about it during dinner. And she stops at one point and she goes, "Bad things don't ever happen to pregnant people, do they?"
What?
And I mean, she was a college-educated, smart woman. And I just, it was just one of those things where my just jaw dropped on the floor and thought, oh my gosh, you have no idea, And she went on to have a beautiful pregnancy, and hers was great. But that was one person's experience. And there is not... It had never occurred to me that people didn't see or understand the realities of childbirth. And I think if you haven't been pregnant, you don't understand. And even if you have, maybe you got lucky.
Right.
It is the craziest system of making more people. I cannot believe this is how we do it.
We really need to go to an external egg-based system, I think. It's a much better...
We need to be oviviparous as a species.
100%. I think so. One of the things that I wanted to talk about, because we were sort of headed in this direction anyway, just really quickly, is just one of the most interesting points of this conversation. You were talking about valuing the life of the woman, valuing the life of the fetus. There's a bodily autonomy argument that needs to be discussed. There's this notion that women, if they are not allowed abortions, are being forced to use their body to support another person's body, and we don't have the right to ask that of another person.
Agreed.
Yeah, completely.
I mean, it's one of those. Someone likened it to well, you are a technical. You're a match as a liver donor, so you have to donate your liver,
right,
or whatever. Yeah. We don't have the right to ask one person to use their body to save another body. That's not a right that this other body has.
Absolutely.
And I think that gets to what is kind of ironic about this whole conversation is, I think. And you guys can tell me if you disagree with this.
I already do.
That I think if you are a man, you have basically really nothing to say about this unless someone you are intimately involved in is carrying a child that you have some involvement with. I think then you have an opinion. Mm-hmm. I think outside of that, you don't. Do you think I'm wrong?
Well, I think even then, there's an ultimate opinion that the woman has.
I think you have
that trumps you.
Yes, I think you have an opinion.
Yeah, you get to say your opinion at that point.
Yes,
you have an opinion. You don't get to make the final decision.
I 100% agree with that.
Right,
but absolutely, you have an opinion. And I think for people who go through this, who are in relationships, they want to have this discussion with their partner. They want. It's important to be able to kind of talk through that whole process. I mean, it's an important part of a relationship to have that communication, and an unintended pregnancy can have a really profound impact on a relationship, and you should have an opinion about it. But ultimately, it's your partner's choice, not yours.
I totally agree. And so if you're a man standing outside an abortion clinic or a medical provider screaming at a complete stranger, you are wrong.
Right.
You are wrong to be doing that.
Frankly, if you are outside of any clinic screaming at anyone seeking any kind of medical attention, you're already wrong. It doesn't matter if they're looking for an abortion or if they're, looking to get their abscessed tooth taken care of.
What if you hate tonsillectomies?
Well,
you want to stop that from happening. I mean, yes, it's that absurd.
It's so silly.
At some point, and this is, I think, maybe a place to take the conversation is, I sympathize. Dan said this earlier. And if you, like you said, if what you believe is happening because of whatever, misinformation or bullshit or something in the Bible that you shouldn't be reading anyway because it's a dreck, if you think what's happening is a viable baby is being killed, I understand that you would be animated about that.
Yeah.
So even, to our friends leaving religion, we have a lot of people who are leaving religion or post-religion who I think are still struggling with this issue. Struggle with it as you must, but remember what we were talking about earlier is other people's bodily autonomy.
Yeah.
Understand that you're struggling with it is not their fucking problem.
And take a moment to try and imagine what that situation is like of becoming pregnant and really knowing that this is not right for you for whatever reason.
That this is a life-altering event that's occurred.
Absolutely. Yes. Yeah. Yes. How would you feel that? And can you empathize with a woman's, or I should say a person, because, trans men have abortions too. So I don't want to be exclusionary, but with a person who is going through that, take a moment to try and empathize with that decision. I tell my patients all the time, abortion is, I think, an incredibly loving decision. What more loving decision to say that I cannot be the parent that I know I need to be or I should be. And so I am choosing to end this pregnancy so that if and when I am ready to parent in the future, I can be in the best possible situation in order to do that. I think there is nothing selfish about abortion. I think it is an incredibly loving decision. And I think people should embrace that.
Yeah. Well, I think that is a lovely note to end this conversation on. We'll probably have more conversations in the future, but thank you, Dr. D, so much for sorting us out on this issue.
Yeah.
Thank you. Thank you for having this discussion. I mean, I think we should continue to talk about abortion. It is a real thing. And if you think you don't know anybody who's had an abortion, that's because they've just chosen not to tell you. Because
they're afraid because of all this social shame and all the garbage that surrounds it.
So. Or because it's none of your goddamn business.
Also that.
Well, I will include several of the links that you provided to us, Dr. D, that include some really, really interesting stats. And some other information and maybe some resources. So, and we certainly invite listeners to, chime in and let us know about their experiences and their opinions, because I think this is something as a community, as a skeptical post-religious community, we still have a lot of work to do.
Yep.
Yeah. So and we need to talk about it.
Yep.
All right. Thanks, Dr. D.
Thank you, guys.
Okay, bye.
Moving on.